You wake up tired, not I didn't sleep enough tired. I mean, you got 7, 8 hours and you still drag yourself out of bed like somebody poured concrete into your legs overnight. And you think, okay, maybe I need more coffee. So you have the coffee. And then you have another one. And by noon, you've still got this fog sitting right behind your eyes, this weird pressure where your brain just won't load, like a browser with too many tabs open and no way to close them. And then there's the puffiness. Maybe it's your ankles by the afternoon. Maybe it's your face when you look in the mirror first thing in the morning. Just a little bloated, a little off. Your rings feel tighter than they used to. Your shoes feel tighter. And you think, I've just been eating too much sodium. I've been sitting too long. It's the heat. Your lower back has been bugging you. Not sharp pain, just a dull, deep ache sitting right there in the middle of your back, maybe on one side, maybe both. You've been blaming your office chair. You bought a new pillow. You started stretching. It helps a little, then it comes back. Your skin's been doing weird things. Dry patches, an itch you can't quite get rid of, especially at night. Maybe a little duller than it used to look. And you've noticed, and this one's strange, sometimes there's this faint metallic taste in the back of your mouth, like pennies. And food doesn't taste quite right. You used to love your morning eggs. Now they smell weird to you. Your appetite is just off. You're urinating more at night, or less than you used to during the day. The color's been strange sometimes, darker or foamy with this weird little foam ring when it hits the toilet water. And you've been thinking, I'm just stressed. I'm getting older. This is just life. I need you to stop right there, because those aren't random, unrelated symptoms. Every single thing I just described, that is your kidneys right now in real time, sending you distress signals. And the problem is, most of us have been trained to ignore them. Not anymore. Let's talk about what's actually going on. The cost of ignoring it. Here's something that genuinely bothers me, and I say this as someone who cares about this stuff deeply. Most people who have kidney disease right now in the United States have absolutely no idea. We're not talking about a small number of people. The CDC estimates that 37 million Americans, that is 1 in 7 adults, have chronic kidney disease. 37 million. And of those, 9 out of 10 don't know they have it. Let me say that again. 9 out of 10 people with damaged kidneys are walking around right now thinking they're fine, going to work, going to their kids' soccer games, eating whatever they want, completely unaware that their kidneys are operating at reduced capacity and have been for months, maybe years. And here's why this happens. The kidneys, and I want you to really hear this, are designed to compensate. They are remarkable at compensating. You can lose 40–50% of your kidney function and feel mostly okay, tired maybe, a little foggy, some swelling. All the things you and I just went through at the top of this video, things that are easy to explain away, that's what makes this so dangerous. It doesn't scream at you. It whispers. So let me paint you a picture of what happens when the whispers go ignored. Year 1, the symptoms we talked about. The fatigue, the puffiness, the backache, the weird metallic taste. You chalk it up to stress, aging, diet, bad sleep. You move on. Year 2, the swelling gets worse. Your blood pressure starts creeping up and your doctor mentions it at your annual visit. They maybe put you on a low dose of something. They don't connect it to your kidneys yet because nobody's ordered the right tests. Year 3, your body is working overtime to compensate for declining filtration. Waste products that your kidneys should be filtering out, creatinine, urea, potassium, start building up in your blood. You feel it. You're more than tired now. You're exhausted in a way that sleep doesn't fix. Your concentration is genuinely impaired. Your skin is itching constantly. Relationships start to feel harder because you're running on empty all the time. Year 4, year 5, now you're looking at what nephrologists call the late stages of CKD, chronic kidney disease. Stage 3, stage 4. Now the symptoms are impossible to ignore. You've got high blood pressure that won't respond to medication the way it should. You've got anemia because your kidneys have stopped producing enough erythropoietin, the hormone that tells your body to make red blood cells. Your bones are getting weaker because your kidneys can't activate vitamin D properly anymore. And your cardiovascular risk? Through the roof. Because damaged kidneys and heart disease walk hand in hand. They are deeply connected. And for some people, too many people, the first time they get a real diagnosis is when they're already in stage 4 or stage 5 kidney failure and someone's mentioning dialysis. Dialysis. 3 times a week. 4 hours a session. A machine doing the work your kidneys can no longer do. That's not a life anyone wants. Now listen, I'm not telling you any of this to scare you. I genuinely am not. Fear without direction is useless. What I'm trying to do is give you the kind of honest, real information that your doctor would love to give you if they had more than 7 minutes with you at your appointment. Because the truth is, if you catch this early, if you know what to look for, your kidneys have an extraordinary ability to heal, to stabilize, to recover. But you have to know the signs first. So let's go through them. All 7. And by the time we're done, you're going to understand your body in a way most people never do. And you're going to have a real specific action plan, not eat better and drink more water nonsense, actual steps you can take starting today. The 7 warning signs. Sign number 1, crushing persistent fatigue. Okay, sign number 1. Fatigue, but not just any fatigue. Let's be specific about what kidney-related fatigue actually feels like, because there's a difference. Normal tired is, I pushed hard this week and my body wants rest. Kidney fatigue is different. It's this bone-level exhaustion that doesn't respond to sleep. You wake up tired. You drink coffee and feel a brief lift, and then you crash harder than before. Your motivation evaporates. The things you used to enjoy feel like effort. And it's not depression. It might look like depression on the surface, but the root cause is physiological. Here's what's happening biologically. Your kidneys produce a hormone called erythropoietin, EPO. EPO is what signals your bone marrow to make red blood cells. Red blood cells carry oxygen. When your kidneys are damaged or stressed, they stop making enough EPO. Less EPO means fewer red blood cells. Fewer red blood cells means your tissues and muscles and brain are running on less oxygen than they need. That's anemia. And anemia feels exactly like what I described. Crushing, pervasive, won't go away fatigue. On top of that, when the kidneys aren't filtering efficiently, a compound called uremic toxins build up in your blood. Urea, creatinine, other waste byproducts. And these toxins, they interfere with everything. Sleep quality, muscle function, cognitive performance. You feel it in all of it simultaneously. What can you actually do today? First, get a simple blood test called a CMP, a complete metabolic panel, and ask specifically for your creatinine and BUN, blood urea nitrogen levels. These are the 2 primary markers that tell you how hard your kidneys are actually working. You can ask your doctor or, and I want to be honest with you here, there are labs where you can order this yourself for under $30 without a prescription. Knowing your baseline number is step 1. Second, and this is for right now today, look at your iron intake. Kidney-related anemia isn't always about EPO alone. It's often made worse by low iron. Dark leafy greens and spinach, Swiss chard, pumpkin seeds, lentils if your kidneys are still healthy enough to handle the potassium. Talk to your doctor about your iron levels, because supplementing when you don't need to can cause its own problems. And third, reduce your caffeine after noon. I know that sounds small, but caffeine suppresses EPO receptors and disrupts the deep sleep cycles where your body actually tries to repair cellular damage. You're making a bad situation worse every time you reach for that afternoon coffee. Sign number 2, changes in urination. This one is one of the most direct signals your body can send you. And most people completely ignore it because, honestly, we're not taught to pay attention to what happens in the bathroom. Let's talk about the changes that matter. Foamy urine? If your urine looks like there's a ring of foam or bubbles around the edge that persists for more than a few seconds, not the quick fizz you might see occasionally, persistent foam is a red flag. What you're seeing is protein, specifically albumin, leaking into your urine. Healthy kidneys keep protein in your blood where it belongs. When the filters, the glomeruli, are damaged, protein leaks through. This is called proteinuria, and it is one of the earliest, most reliable signs of kidney damage. Urinating more at night. This one catches people off guard. You've always been a good sleeper, and now you're getting up once, twice, sometimes 3 times a night to urinate. That's called nocturia. During the day, when you're upright and active, mild kidney dysfunction can still filter okay. But at night, when you lie down and your blood redistributes, stressed kidneys suddenly try to catch up, and they do it by producing more dilute urine. So nocturia, especially when it's new for you, is worth paying attention to. Dark or cola-colored urine. This can indicate blood or a heavy concentration of waste in your urine. Brown or tea-colored urine needs to be checked. Same day if you can. Don't wait on this one. Reduced output. If you feel like you're not urinating much or urinating less than you normally do, that can mean your kidneys are struggling to produce enough filtrate. If you also have swelling, this combination is particularly concerning. What can you do today? Check your urine color right now. I mean it. The target color is pale yellow, the color of lemonade, not apple juice. Dark yellow means you're dehydrated. Colorless means you've overhydrated. Pale yellow is the goal. For hydration specifically, the formula I recommend, and this is backed by solid research, is half your body weight in ounces of water per day. So if you weigh 180 pounds, aim for 90 ounces of water. That's about 11 cups. Spread it through the day, not all at once. And I want to be clear, if you already have kidney disease, talk to your doctor about your fluid limit, because too much water can actually be a problem in later stages. And next time you use the bathroom, look before you flush. I know it sounds like a lot, but this is one of the simplest diagnostic tools you have available to you for free every single day. Sign number 3. Swelling in the ankles, feet, face, or hands. Swelling, the medical term is edema, is what happens when fluid that should stay in your blood vessels starts leaking out into surrounding tissues. And your kidneys are one of the primary regulators of fluid balance in your entire body. Here's the mechanism. Your kidneys control how much sodium you retain. Sodium holds water, that's just chemistry. When kidney function declines, sodium regulation goes haywire. You start retaining more sodium, which means you retain more water, and that water has to go somewhere. It pools in your feet and ankles because of gravity. It accumulates in your face overnight, that puffy, swollen look in the morning. It can build up in your hands, making your rings feel tight. Now, swelling can be caused by other things. Heart failure, venous insufficiency, certain medications. So I'm not saying swelling alone means kidney failure, but kidney-related swelling has a few specific patterns. It tends to be bilateral, both ankles, not just one. It tends to be pitting edema, which means if you press your thumb into the swollen area for 5 seconds and then release, it leaves an indent. That's fluid, not fat, not inflammation. And it often gets worse as the day goes on and better in the morning after you've been lying flat. Also, this is important. Kidney-related swelling often comes alongside other signs on this list. The fatigue, the changes in urination. If you've got 2 or 3 of these things overlapping, that pattern matters. What can you actually do? First, reduce sodium immediately. Not a little bit. Actually read labels and get your sodium under 2,000 milligrams per day. For context, 1 can of soup can have over 1,000 milligrams. The American diet is saturated with hidden sodium. Deli meat, bread, condiments, restaurant food. Your kidneys are working against you every time you eat a high-sodium meal. Second, elevate your legs when you're sitting or resting. Prop them above heart level. This helps the fluid drain back into circulation where your body can process it. Third, move. Even a 10-minute walk helps pump the lymphatic system and improve circulation. Sitting for 8 hours is genuinely terrible for fluid retention. And honestly, if you have significant pitting edema in both ankles that doesn't resolve overnight, please go get checked out. This is not something to manage with home remedies alone. This is your body telling you it needs some professional attention. Sign number 4, persistent back or side pain. This is the one where people say, "Oh, I just tweaked my back." And sometimes they're right. But kidney pain and back pain feel different, and it's worth knowing the difference. Kidney pain, called flank pain, typically sits in the area just below your rib cage on your back on one or both sides. Not in the very lower lumbar area where most people think of back pain, but higher around the kidneys themselves, which sit in the posterior part of your abdomen on either side of the spine. The character of the pain matters. Musculoskeletal back pain tends to change with movement. It gets worse when you bend a certain way, better when you stretch, responsive to positioning. Kidney pain is deeper and more constant. It doesn't really change much with how you move. It just sits there. Sometimes it radiates forward toward the abdomen or groin. Sometimes it comes in waves, especially if you've got a kidney stone passing through. Kidney stones are actually worth talking about for a moment here, because a lot of people don't realize that kidney stones are themselves a sign of kidney stress. They form when your urine becomes too concentrated with certain minerals, calcium, oxalate, uric acid, and they crystallize. Passing a small stone can feel like a dull ache. Passing a larger stone, I've heard people describe it as the worst pain of their lives. Worse than childbirth? That's not an exaggeration. But even before a stone becomes large enough to cause acute pain, it can cause chronic irritation and damage to the kidney tissue. Kidney infections, moist pyelonephritis, also cause this kind of flank pain, often with fever, chills, and a burning sensation when urinating. That's an acute situation that needs antibiotics. Don't wait on that one. What can you do? Hydration is the #1 strategy for kidney stone prevention. It keeps your urine dilute enough that minerals don't crystallize. The 90-ounce-a-day target we talked about? This is another reason for it. Second, if you tend to form calcium oxalate stones, which is the most common type, limit high oxalate foods like spinach, beets, nuts, and chocolate. I know, chocolate is on the list. I'm sorry, but moderation matters here. Third, cut back on animal protein. High-protein diets, especially heavy on red meat, increase uric acid production, which contributes to both uric acid stones and general kidney inflammation. You don't have to go vegetarian, but if you're eating red meat every single day, that's worth reconsidering. And if you have flank pain that's persistent or that comes with fever or blood in your urine, please go get evaluated. That is not a wait-and-see situation. Sign number 5, skin problems, itching, dryness, rashes. This one surprises people because we don't think of our skin as connected to our kidneys. But your skin is actually one of your body's secondary filtration systems. When your primary filters, your kidneys, are overwhelmed, some of that waste burden falls on the skin, and you feel it. The most specific kidney-related skin symptom is itching, called uremic pruritus, that's chronic, often worse at night, and doesn't have an obvious skin-level cause. No rash, no contact with an irritant. Just this relentless itch that antihistamines don't really touch because it's not histamine-driven. It's caused by uremic toxins building up in the skin. Phosphorus in particular, and when your kidneys can't clear excess phosphorus from the blood, it deposits in tissues, including the skin, and it is incredibly itchy. Kidney disease also causes the skin to become dry, pale, or yellowish because of anemia, less blood reaching the surface, and because the skin isn't getting the right nutrient balance it needs. Some people develop a condition called uremic frost in very advanced disease, a literal crystallized layer of urea on the skin. That's extreme. But the earlier dryness and pallor, very common. And here's something a lot of people don't know. Your kidneys activate vitamin D. The final conversion of vitamin D into its active form, calcitriol, happens in the kidneys. When kidneys aren't working right, you become functionally vitamin D deficient, even if you're getting plenty from the sun or supplements. And vitamin D deficiency shows up in your skin: slower healing, more susceptibility to infections, inflammation, dullness. What can you actually do? Get your vitamin D levels tested. A simple blood test, 25-OH vitamin D, normal is between 30 and 50 nanograms per milliliter. Most Americans are below that. If you're deficient, supplementing under medical guidance can make a significant difference, not just for your skin, but for kidney protective effects as well. Cut phosphorus-heavy processed foods. The biggest offenders are colas, especially dark colas, which have phosphoric acid added directly, processed cheese, fast food, and packaged meats with phosphate preservatives. Check labels for anything with phosphate in the ingredients list. That's added phosphorus your body absorbs at a very high rate. For the itching itself, cool water, not hot. Hot water inflames already sensitized skin. Fragrance-free moisturizers immediately after bathing. And if the itching is severe and persistent, your doctor can check your phosphorus levels and your BUN. Don't just suffer through it. Sign number 6, brain fog and difficulty concentrating. Okay, this one is close to my heart because it's the most underestimated symptom on this list. People feel it constantly. They dismiss it as stress or age or too much screen time, and they never connect it to what their kidneys are doing. Actually, let me back up for a second, because I want to make sure you really understand the connection here, because it's not obvious. Your brain runs on clean blood. It needs properly oxygenated, properly balanced blood to function. When your kidneys are struggling, two things happen that directly impair brain function. Number 1, uremic toxins. We talked about these already, but in the brain specifically, compounds like indoxyl sulfate and p-cresyl sulfate, which are byproducts of protein metabolism that your kidneys should be clearing, cross the blood-brain barrier and interfere with neurotransmitter function. They're neurotoxic. They cause what researchers have documented as uremic encephalopathy in severe cases, but in mild to moderate kidney dysfunction, they show up as exactly the symptoms you might recognize: poor working memory, difficulty concentrating, slower processing speed, emotional irritability, feeling mentally slow. Number 2, the anemia we discussed in sign 1. Your brain uses 20% of your body's oxygen supply despite being only 2% of your body weight. It is enormously oxygen dependent. When red blood cell count drops because of reduced EPO production, your brain is one of the first organs to feel the oxygen shortfall. And here's the cruel part. When your brain is fogged, you're less likely to make the right food and lifestyle choices. You're more likely to reach for sugar and caffeine. You're less likely to exercise. The kidney dysfunction creates the fog that makes it harder to address the kidney dysfunction. It's a loop. What can you do today? First, creatine. Not for bodybuilding, hear me out. Creatine monohydrate at a modest dose of 3 to 5 grams per day has been studied for its cognitive benefits and specifically for its role in supporting brain energy in situations of metabolic stress. Emerging research is also exploring its effect on reducing uremic-related cognitive impairment. It's inexpensive. It's safe for most people. But, and this is a real but, if you have existing kidney disease, creatine can actually elevate creatinine levels and confound your lab results. So talk to your doctor before starting it. Second, omega-3 fatty acids. EPA and DHA from fish oil have a well-documented anti-inflammatory effect on the brain and specifically on kidney function. Studies show omega-3 supplementation reduces proteinuria and slows the progression of kidney disease. And it directly supports cognitive performance. 2 grams a day of a quality fish oil is something worth considering. And third, get off the ultra-processed food. I keep coming back to this. Processed food is full of ingredients, food dyes, preservatives, phosphates, excessive sodium, that place a constant burden on your kidneys and contribute directly to brain inflammation. Every day you eat ultra-processed food, you're making your kidneys work harder and your brain work worse. Sign number 7, metallic taste and loss of appetite. This one is often the last to appear on the list and the one that makes people realize something is really wrong. Because it's strange. It's specific, and it's hard to explain away. The metallic taste, called dysgeusia, comes from uremia. Urea building up in the blood at high concentrations begins to be excreted in saliva, where oral bacteria break it down into ammonia. Ammonia has a metallic, almost chemical quality on the palate. Some people describe it as pennies. Some say it's more like a bitter chemical aftertaste. Some people notice it especially after eating protein, meat, eggs. This is why kidney disease often causes profound changes in appetite. Your favorite foods start to smell or taste wrong. Protein sources especially become aversive. Your body is actually trying to protect itself. If you're not processing protein waste properly, eating less protein makes metabolic sense. But the problem is, malnutrition becomes its own serious issue on top of everything else. Nausea is common at this stage too. Morning nausea, especially similar to what people experience in early pregnancy, because toxin levels are highest after the overnight fast. And the appetite loss creates a spiral. Less food means less nutrition, means weaker immune function, less muscle mass, more fatigue, more difficulty healing. The body starts to break down. Now here's the important nuance. Metallic taste alone doesn't mean kidney failure. Iron deficiency anemia causes it. Zinc deficiency causes it. Some medications cause it. Pregnancy causes it. But metallic taste combined with the other signs on this list, that pattern is telling you something very specific. What can you do today? First, check your zinc levels. Zinc deficiency is extremely common, almost epidemic in the American diet, and it causes both metallic taste and loss of appetite on its own. Foods high in zinc, pumpkin seeds, hemp seeds, cashews, oysters. A modest zinc supplement, 15 to 25 milligrams under your doctor's guidance can help. Second, brush your tongue. Literally, get a tongue scraper. Uremic compounds deposit on the tongue and contribute to the metallic taste. Oral hygiene is actually connected to kidney health in ways most people don't realize. Periodontal disease creates a chronic inflammatory load that taxes kidney function directly. Third, if you've lost your appetite significantly, tell your doctor. Not "I've been off my food." Be specific. "I'm experiencing metallic taste, nausea, and significant appetite reduction, and I want my kidney function tested." Those exact words. Be that specific. Because vague symptoms get vague responses. Bonus, connecting the pattern. Before we get into the healing section, I want to say something about pattern recognition. Because any one of these 7 signs on its own could have an innocent explanation. Fatigue could be thyroid. Foamy urine could be an artifact of forceful stream. Swollen ankles could be venous insufficiency. But here's what I want you to hold on to. If you're sitting here nodding to 3, 4, 5 of these signs, that pattern is not coincidence. That pattern is communication. Your body is incredibly good at sending signals if you know how to receive them. The kidneys don't fail overnight. They decline slowly over months and years, whispering the whole way down. What you've just learned is how to hear those whispers. And now, let's talk about what happens when you actually listen. Healing phase, your kidneys can recover 1830 to 2130. Your kidneys are not passive organs waiting to fail. They are dynamic, living tissue, and given the right conditions, they are remarkable at recovering function. I need to be honest with you here. Stage 5 kidney disease, end-stage renal failure. That's a different conversation. That requires dialysis or transplant, and the recovery of lost nephrons at that point is extremely limited. I'm not going to sell you a miracle, but stages 1 through 3, early to moderate kidney disease, the research on kidney regeneration, on slowing and in some cases partially reversing CKD, is genuinely hopeful. This isn't wishful thinking. This is biology. Here's what we know. Blood pressure control is the single most impactful thing you can do for kidney preservation. High blood pressure damages the glomeruli, the tiny filtration units in the kidney. There are approximately 1 million of them in each kidney. Every episode of sustained high blood pressure destroys some of them permanently. But when blood pressure is brought under control through diet, weight management, exercise, medication if needed, the rate of damage drops dramatically. The SPRINT trial, a landmark study, showed that intensive blood pressure management reduces the progression of kidney disease by a significant margin. Target below 130/80. Blood sugar control is equally critical. Diabetic nephropathy, kidney damage from diabetes, is the leading cause of kidney failure in the United States. But even in people without diagnosed diabetes, insulin resistance and blood sugar spikes are destructive to kidney tissue. A study out of the American Journal of Kidney Diseases found that people with prediabetes who brought their blood sugar under control through diet and exercise showed measurable improvement in kidney filtration rates. Measurable. Real. Documented improvement. Your diet is medicine. A diet low in sodium, moderate in protein, not zero protein, moderate, rich in vegetables, whole grains, and anti-inflammatory fats supports kidney function directly. Specific foods with well-documented kidney protective effects. Blueberries, which are high in anthocyanins that reduce oxidative stress in kidney tissue. Cranberries, which prevent bacterial adhesion to the urinary tract. Olive oil, extra virgin, which reduces inflammatory markers specifically linked to kidney disease progression. Red bell peppers, which are low in potassium and phosphorus and high in kidney-supportive antioxidants. Exercise. Even walking 30 minutes a day, 5 days a week has been shown to reduce the rate of kidney function decline in CKD patients. Exercise improves blood flow, reduces blood pressure, improves insulin sensitivity, reduces inflammatory cytokines. Every mechanism that exercise touches also protects your kidneys. Quit smoking. I'm not going to sugarcoat this one. Smoking causes direct vascular damage to the small blood vessels in the kidney. It is an independent risk factor for CKD progression, separate from blood pressure and diabetes. If you smoke, quitting is the single highest leverage action you can take for your kidneys. Yes, higher leverage than diet. Higher leverage than supplements. Quit smoking. NSAIDs. I want to call these out specifically because so many Americans take ibuprofen and naproxen casually like they're harmless. They are not. Chronic, regular use of NSAIDs reduces blood flow to the kidneys and can cause a condition called analgesic nephropathy, literally kidney damage from painkillers. If you're taking ibuprofen multiple times a week for chronic pain, please talk to your doctor about alternatives. Acetaminophen is easier on the kidneys. Topical anti-inflammatories. Physical therapy. The occasional NSAID is fine. Chronic daily use is not. And here's the practical challenge I want to leave you with. Not 12 things. Not a complete overhaul of your life. One thing, in the next 24 hours, I want you to do one of these. Get a glass of water right now and calculate whether you've hit your daily intake target today. Or look up the nearest lab and price out a comprehensive metabolic panel with creatinine and BUN. Or swap out your afternoon soda for water. Or put a blood pressure cuff on your Amazon list. Just one thing. The momentum starts with one thing. Your kidneys filter 200 liters of blood every single day. 200 liters. They maintain the precise balance of every electrolyte in your body. They regulate your blood pressure. They produce the hormones that make your red blood cells. They activate your vitamin D. They protect your bones. They do all of this silently, without complaint, for decades, and they ask almost nothing in return. When they finally start asking, when the fatigue hits, when the swelling starts, when the fog rolls in, when the taste changes, that's not weakness. That's communication. That's your body trying to tell you something before it's too late to act. And now you know how to listen. You know what the 7 signs are. You know what they mean biologically. You know what to do about each one. You are more equipped right now than 90% of people who are silently walking around with kidney damage today. Please don't waste that. If any part of this video hit close to home, if you were nodding along, if you recognized yourself in that list of symptoms, take that seriously. Not with panic, with intention. Make an appointment. Get the labs. Change one thing today. And if this helped you, share it. I mean that. Share it with someone you love who complains about being tired all the time, who has puffy ankles, who's been ignoring the signs, because they might not see this on their own. And the information you just shared with them might genuinely change the trajectory of their health. Take care of yourself. I mean it. Your kidneys already are. Let's make their job a little easier.